discharged from the ICU after their illness. Now, when we feed patients, the question is how much should we feed them? I just wanted to place this slide to emphasize the fact that you can start seeing some of the benefits even when you are giving what we call trophic feeds, or giving smaller amount of feeds because you're concerned that the patient may not tolerate. So you can start seeing some of the immune benefits as early as about 15 to 30% of calories and proteins when you're providing. The reason why we always emphasize on using the gut is ensuring that the visceral blood flow would be there. You're not going to cause gut ischemia. If you don't use it, the cells are going to die. So that effect you can start seeing again as early as 10 to 20% of the calories when you are starting to feed. So feed something if you can't feed the whole amount, or whatever is your goal. But a lot of studies have shown that to get the maximum benefit or all the benefits, you need to feed at least about 50 to 60%, which is why a lot of the guidelines, as you can see, might say that you need to escalate the feeds gradually, but within 3 to 5 days, aim for a particular goal. And again, you will see different numbers in different studies and guidelines, but somewhere around 60 to 80% is what a lot of them would quote in about 3 to 5 days once you initiate the feeding. Now, this is a concept that is increasingly being thought about. Just as how we are thinking about nosocomial infections, healthcare associated infections, healthcare associated issues, remember that there is also healthcare associated malnutrition. If we are underfeeding the patient, or even if we are overfeeding the patient for that matter, we may be leading to issues which we need to be aware of. And a lot of these nutritional deficiencies can occur just by the sheer fact that the patient currently has some significant physiological derangements and organ dysfunction. So keep that in mind when you are targeting your nutritional goals. Now, certainly when you are thinking about an ICU patient, each ICU is going to be different, and each unit may have different variety of patients. Not all patients are the same. There are units where it almost functions like a monitoring unit, where you may not have very sick patients, which is fine. I mean, smaller hospitals may need to monitor every post-operative patient there, or even somebody whom they just want to observe overnight, maybe in an ICU, who may not fit the typical category that I'm thinking about or talking about when somebody is critically ill. So keep it in mind that not all patients are the same. The impact of nutrition therapy on the outcomes is also not expected to be the same on all the patients, because they are different. Which takes us to the question of who would benefit the most, and that's where the screening and the assessment, I know Daphne is going to talk next, and there is going to be other talks on screening and assessment, would make a big impact on identifying the group of patients who are probably going to significantly benefit from the nutrition therapy that you are giving. Lot of parameters are there. Again, this may be slightly repetitive if